this festive season, we will greet the new year not with joy, but with sorrow. Many of our friends, relatives, and co-workers will be infected. Some will get severely ill, and some, tragically, will also die. Unless we do things differently, this will be the last Christmas for many, many South Africans. This is certainly what we do not want. We all want to live and let our loved ones also live. It is therefore essential that we take extraordinary measures to contain the second wave with a view to saving lives while we continue to protect livelihoods. My fellow South Africans, 11 days ago, we declared Nelson Mandela Bay to be a coronavirus hotspot area, in line with our differentiated approach to the management of the pandemic. There are other municipalities that have also shown a particularly sharp rise in infections. Minister of Health, Dr. Zwelini Mkhize, has visited these areas, and after consultations with various stakeholders, Cabinet has decided to also declare the following 2 districts as coronavirus hotspots. And these are the Sarah Baartman district and secondly, the Garden Route district. This all means that the same additional restrictions that we applied to Nelson Mandela Bay will apply in these districts with immediate effect from midnight tonight, and will continue until we see a clear and sustained decline in infections. While these hotspots areas require particular attention, the festive season itself poses significant risk for the entire country. We have therefore been undertaking consultations in provinces, including at municipal level, on the measures that need to be taken to contain the second wave of infections. There have been extensive deliberations within the National Coronavirus Command Council and the President's Coordinating Council, which brings together representatives of national, provincial, and local government together, including our traditional leaders. Based on the recommendations from these meetings, Cabinet has decided that further restrictions need to be imposed nationwide from midnight tonight with immediate effect. Firstly, we will ensure that there is stricter enforcement of existing Alert Level 1 restrictions throughout the country during the festive season and beyond. This includes the requirement that drivers and operators of any form of public transport must ensure that all passengers who get into their vehicle must wear a mask. The managers or owners of buildings or places or premises, including retail stores, shopping centers, and government buildings, are obliged by law to ensure that all customers who enter their facilities or buildings must wear a mask. An employer must ensure that all employees wear masks while they perform their duties. This places a responsibility on all owners, managers, and employers, and on all of us indeed, to ensure that South Africans are safe whenever they are in any of these places. The responsible individuals who do not ensure compliance with the regulations by their passengers, customers, or employees will be liable to a fine or to imprisonment of up to 6 months. Secondly, We are taking measures to reduce the risk of super spreading events. The current restrictions on the size of gatherings do not do enough to prevent crowding in the current situation where new cases are rising rapidly. Therefore, gatherings, including religious gatherings, may not be attended by more than 100 people for indoor events and 250 for outdoor events. At all times, and particularly in smaller venues, the total number of people in a venue may not exceed more than 50% of the capacity of the venue. All gatherings must include adequate ventilation. They must also demonstrably show that there is social distancing. There must be wearing of masks and provision of hand sanitizers. Due to the potential for transmission, all post-funeral gatherings, the so-called after-tears parties, are prohibited. One of the greatest challenges we need to confront are the huge crowds that flock to our beaches and recreational parks on public holidays over the festive season. We have undertaken extensive consultation on this issue so that we can find an approach that reduces the risk of large-scale transmission while limiting the negative impact on businesses in coastal areas of our country. We have therefore agreed to adopt a differentiated approach which takes into account the different circumstances in different areas of our country. In the areas with the highest rate of infection, beaches and public parks will be closed for the duration of the festive season from the 16th of December to the 3rd of January. This will apply specifically to all of the Eastern Cape, as well as the Garden Route district in the Western Cape. In KwaZulu-Natal beaches and public parks, this will be closed on what are traditionally the busiest days of the season. And these days are the 16th of December, the 25th, the 26th, 31st of December, as well as the 1st and the 2nd and the 3rd of January 2021. The beaches and public parks of the Northern Cape and the Western Cape, with the exception of the Garden Route, will remain open to the public over the festive season. Festivals, live music, live performances at beaches are prohibited. Beaches and parks that are open to the public will only be open between 9 a.m. and 6 p.m. The situation will be monitored daily by local authorities to ensure compliance with the regulations on gatherings and the prohibition of the sale and consumption of alcohol. In instances where there are large crowds or poor compliance with safety measures, specific beaches and recreational parks will be closed. National and provincial parks and other parks where access control measures and entry limitations are already in place may remain open to the public. This is a most trying situation for all of us, but it requires constant attention. I have directed that all members of the National Coronavirus Command Council and key personnel should be on standby to ensure constant monitoring and assessment of the situation countrywide throughout this festive season. In other words, whatever leave they may have had will be a light leave. It will be tempered by the need to have consultations and meetings. So all of them will be on standby to be able to meet with immediate effect if the situation across the country deteriorates. And should the situation deteriorate, further action will be taken to protect our people. The third area of focus over this period is to prevent super spreader events and reduce the burden on healthcare services due to irresponsible alcohol consumption. Therefore, the following measures will be implemented. The hours of the curfew will be longer, starting at 11 p.m. and ending at 4 a.m. Non-essential establishments, including restaurants and bars, will have to close at 10 p.m. so that staff and patrons, that is customers, can go home before the enforcement of the curfew. The curfew is meant to prevent gatherings that go on late into the night and into the morning, while enabling restaurants, bars, and taverns to continue to operate and earn an income. We should all remember that the hours of curfew also apply to Christmas Eve or New Year's Eve. This means that we will all need to make changes to the way in which we celebrate these occasions. The sale of alcohol from retail outlets will only be permitted between 10 a.m. and 6 p.m. from Monday to Thursday. Registered wineries and wine farms may continue to offer tastings and wine sales to the public for off-site consumption over weekends. This exception is being made due to the vital contribution of these establishments to the tourism sector in several parts of the country. Alcohol consumption in all public spaces, such as beaches and parks, is strictly prohibited. We will not allow large numbers of people congregating in any one place without proper controls or proper protocols being in place. These festive season restrictions will be reviewed in early January based on the state of the pandemic across the country. My fellow South Africans, in determining our response to the second wave of infections, we have sought to carefully balance the need to save lives and to protect livelihoods. The national lockdown, which we imposed at the beginning of the pandemic, was designed to delay the spread of the virus so that we could adequately prepare our health systems to respond to the rise of infections. At that time, we were not ready to cope with a sudden increase of cases and hospital admissions. We needed to secure adequate equipment and supplies to make additional space available in our health facilities and to train our healthcare workers and to put in place systems to monitor and respond to trends in the pandemic. A full lockdown was absolutely necessary then to delay the pandemic, but would not serve the same purpose now. And that is why we are not opting for that option. Over the past several months, we have put in place a range of measures to enhance our capacity to respond. Through the hard work of our health workers, public servants, medical experts, and scientific advisors, we have marshaled all of our resources to protect the people of South Africa and to provide care to those who need it. The measures that we took early in the pandemic and the actions of every South African have allowed us to save many lives already. Now we must protect the gains we've made and work together to contain the second wave. As we have done since the very beginning, we must act based on the best scientific evidence that is available to us. Just as our doctors, nurses, and frontline workers are working tirelessly to protect us, we must work tirelessly to protect them as well. To date, over 38,000 health workers in the public sector have tested positive to COVID-19. Of these, nearly 5,000 were admitted to hospital. Sadly, 391 health workers in the public sector have passed away. As a nation, we owe so much to these brave and dedicated people and to their families, for without them, we would not have come this far. As we confront the second wave of infections, we must do everything we can to support and protect our health workers. Unless we act responsibly now, unless we adhere at all times to the basic precautions that we all know, for our regular activities, festive and safe. This festive season, I'm asking you to keep your celebrations small and to avoid being in crowds. If you are spending time with other people, I ask that you do so outside, enjoying the splendid South African summer weather, or at least to make sure that you are in a well-ventilated space if you are inside. I'm also asking you to wear a mask that covers your nose and your mouth whenever you are in public or in the company of people you don't live with. There is no point in wearing a mask on your chin or keeping it in your pocket or lowering it to speak to someone. Remember to regularly wash your hands with soap and water for at least 20 seconds or with a sanitizer. I also ask that you limit your travel as much as possible. If you have to travel, make sure that you travel safely. If you are going to visit friends and family, limit your number of contacts for at least 1 week before you travel, and try to spend time with only your immediate family or as small a group of people as possible. We know that COVID-19 affects people differently. According to the World Health Organization, most people are likely to develop mild or moderate illnesses and will recover within a short space of time without hospitalization. The most common symptoms are fever, a dry cough, and tiredness. Less common but moderate symptoms are aches and pains, sore throat, and loss of taste or smell. If you experience these symptoms, then you should isolate yourself from others. If you experience severe symptoms such as difficulty in breathing or shortness of breath or chest pain, loss of speech or movement, you should seek immediate medical attention. I'm not a medical doctor, but Dr. Mkhize coaches me. Please remember that if you have tested positive for coronavirus, or if you have been in close contact with someone who tested positive, you should immediately isolate yourself from others. As we have said in the past, the only viable defense we will have against COVID-19 will be the vaccine. Now, when it comes to the vaccine, South Africa has concluded all the necessary processes to ensure its participation in the World Health Organization COVID-19 Global Vaccine Access Facility. This facility, known as COVAX, pools resources and shares vaccine development risk to ensure equitable access to vaccines when they become available. Now, as part of this facility, it is expected that South Africa will receive initial vaccines to cover about 10% of our population in the early part of next year. We are also part of the African Vaccine Acquisition Task Team that I set up as chair of the African Union. And this is looking at alternative financing mechanisms to secure additional vaccines for African countries beyond the COVAX facility. The Minister of Health is part of this task team and is also looking at innovative partnerships here in our country with the private sector to ensure that South Africans have access to an effective vaccine that is suitable to our conditions. Now, I know a lot of information is spreading about the issue of vaccines. I want to assure our people that the Department of Health, our Minister of Health, and all of us in Cabinet are properly seized with this matter, and we will keep on briefing the nation on the issue of vaccines. The next few weeks are going to be a great test of our determination and restraint. This period will require each of us to do things differently to previous years, because this year is unlike any other year that we have lived through before. It will require us to give up some short-lived pleasures, to protect ourselves and others, and to ensure that we can enjoy such times together in future years. I'm convinced that if we each play our part, if we each follow the basic precautions, then we can all have a joyful festive season, and most importantly, we can all have a happy, healthy, and prosperous new year that is dawning. And I wish all of you a blessed festive season, that you may remain safe and in good health, and that you may be able to welcome the new year together with all of us united as a resolute nation. May God continue to bless our beautiful country and all its people and protect us all. I thank you.
So there we have it.
There you have it. That was the address from our president, the President of the Republic of South Africa, President Cyril Ramaphosa. So this is what we're here to do. We're here to analyze, to see what are the surprises that we got, what are the things that we have expected, and how can we now reduce the spread of this virus, because remember, we are still in the pandemic. And right next to me, I still have Uputwam, who's an analyst, who's going to help us, analyze this whole situation. Any surprises?
I think there's not much surprises based on the fact of the stricter restrictions in especially Eastern Cape, Western Cape, and also KZN, when we talk about places like the beaches.
Yes.
And also the issue of alcohol consumption was something that was bothering South Africans, saying although economy-wise it's very good to have alcohol opened and operating normally, however, the complaint was that people are misusing maybe that chance of
That
them,
allowance of
that
having
allowance, yes.
alcohol being sold throughout the day.
Yes, because when we talk about, we thought maybe surprises will be to say the restrictions, the stricter level 1 maybe regulations are now in the whole country with a specification in the Sarapatman district,
Yes.
Garden Route, and also KZN. Maybe that's where our numbers have been peaking a lot recently.
Yes, and Eastern Cape, the Nelson Mandela Bay, has been found as somehow the hotspot for this pandemic, the coronavirus. How do you feel about the restrictions that are made in that area? Do you think they are fit enough to help us reduce the number down?
Yeah, I think with the Command Council, when they did not go all out to put even that place to maybe level 5, to like a total shutdown. Yes. However, they looked at the issue of the economy, because if you look back, those are tourism attraction places, same as the beaches and everything. Although it's not going to be business as usual and also be like any other year. However, the restrictions, I think, if they are followed, and also they've got people who are going to safeguard that these people are not breaking the regulations, maybe that would be something of good, because if you check, we're checking earlier, the industry of tourism have lost about 7 billion in terms of what we call revenues, yes, between the time where we were in the level 5 and the way the last one even to be maybe taken off or to be allowed to operate. So some had to go on protest and go all around the country asking for the president to think about them.
Yes, because now, in order for the economy to be boosted, we need this recreational spots, we need the beaches, we need the national parks, and that is how the economy of South Africa actually can rise once again, because we were in lockdown, we're still in lockdown, just that the restrictions have been lightened a little bit, we're on level 1. So now, how do you think about the curfew that has been put in place for the entire South Africa of 11 to 4 a.m. and also the times in which are put in place for alcohol consumption, and also looking at the fact that our gatherings now have been reduced to 100 in indoor and 250 outside?
Yeah, I think we're not going to get even into this space, provided people had listened to the president and taken care of themselves. Because what the president or the Command Council is trying to do now is to make sure that outside of the hours that people have been given to consume alcohol or have parties, people does not take it further somewhere else. For example, in areas where like the Eastern Cape and the Western Cape and some parts of KZN, where the numbers have gone sky high, you find out that people, maybe an establishment is closing at 11. When the establishment closes, they take the party to somewhere else, yes, and like Galavant until the next morning, at which there is no social distancing, there's no wearing of masks, there's nothing of sort of a protocol into COVID-19 that is taking place. I think the restrictions are there to help us as South Africans, because at the end of the day, like the president said, if we're not behaving, this might be the last Christmas for some of our people.
Yes, most definitely. And another thing is that now I'd rather say the Eastern Cape and the Northwest province, the reason why they're under this strong restrictions, it is mostly because now they are rising in numbers. Now that should be an alert for the other provinces to say, if there is a high number, there will be certain restrictions put in place. Now, what can the other provinces that we have that aren't under such strong restrictions do in order to avoid having to find South Africa under lockdown level 5 all over again?
The best thing to do is to, first, like the president said, people must limit traveling. Like he said again lastly when he said, maybe before you travel anywhere or to other people, first stay and not have much contact of people, because by the time you decide to travel maybe next week, you have met many people you have never tested if you are positive or not. By the time you leave, you'll be spreading the virus anyway. However, other provinces should take maybe these precautions as very serious as possible. For an example, we in the province of Mpumalanga, which borders Mozambique and Swaziland,
Yes.
all the people who are in the other provinces that are affected the most, they pass through the N4, which is the Maputo corridor, towards Swaziland, towards Mozambique, and we are at risk. Look, we've got very big tourism attractions in the province where we might find out that if we are not careful and not adhering to the restrictions, we might find ourselves maybe picking up. Like, for example, we thought, like when we looked earlier, we have about 600 cases in the province with a huge number of recoveries. However, due to the festive season, young people are off school, they are back, they are the ones who are making parties, calling them pens down and everything. That is the main thing that made these other provinces to maybe
Increase in number.
Increase in numbers, yes.
So now, with schools closed and everybody at home, your little kids, your toddlers, your youth, so these are the kind of gatherings that we need to stay away from, or rather not organize, in order for us now to reduce the number and not find ourselves, especially us here in Mpumalanga, not to find ourselves also under strict restrictions. Well, events, those are my main concerns. Events. How now is this going to affect event organizers? Because now that is a way for them to actually gain revenue. Your artists, your upcoming artists, how is this going to affect them?
I think most politicians used to say, in a war, there are collateral damage.
So I guess they are the collateral damage.
Yeah, what I can say is that as long as these maybe event organizers, artists, could adhere to the restrictions, in most of the events that you find out that cases have hiked, there were artists performing, like for example, they'll tell you that there's this big artist coming, and then people who come in numbers to maybe get more money. The owners of establishments does not maybe restrict people from entering because they want gate taking, they want everything. However, our event organizers now, they should be more careful and try by all means to live by the legal number that they are given and try to not even exceed the hours that they are given. Yes. At this time, I would advise maybe saying outdoor events are the only ones because the number is a bit bigger than the 100.
You have a 250
yes,
allowance.
So where people are going to be a bit much more. And you will understand, today is the 14th, tomorrow is the 15th. There are events organized all over the country.
And looking forward to the 16th of December now. That is also one of the peak day events for December, and that is where now event organizers and owners of establishments are looking towards hosting very big celebrities to come through and perform, and it's also a way for them to gain revenue through the selling of alcohol and stuff like that.
It's a fact. However, this time around, like they say, we just have to find ways to live in the new normal. On how are we going to make revenue in the very short space of time that we are given. However, for the best of the humankind in the country especially, yes. If you can check in South Africa, I would say we are lucky. However, let's say we have lost lives. For example, when the president was saying at least 391 health workers in the country have passed away due to COVID-19. And if we are not adhering to the regulations, we are risking of flooding our hospitals and our health system with many people who are sick. And by that, they also infect the health workers. At the end of the day, we will never have anyone to help us.
And speaking of death, it came through today morning that the Prime Minister of Swaziland, Mr. Ambrose Dlamini, passed on yesterday afternoon because of COVID. Now that proves to say it is of utmost importance that we keep social distancing, that we sanitize, that we wear our masks, because COVID-19 hasn't yet passed. And in South Africa, we are experiencing a second wave. Now it proves to say we need to be cautious all the time. Because another thing that came through was that Mr. Dlamini didn't show any symptoms. So because you don't show symptoms, it doesn't mean you don't have COVID-19. Now that is why it's very important that we safeguard ourselves, the places we find ourselves in, that we don't surround ourselves with a lot of people.
One lesson that our viewers should learn is that if people who've got all the resources to take themselves to different maybe institutions, yes, of like high towers in society, the best healthcare, they die from COVID. And then who are we that we can survive? So the best way is to make sure that you safeguard yourself, you do everything possible to maybe run away from getting COVID. Don't go to places where there's many people. Try by all means, if you want to enjoy either your beverages or anything, yes, just have your own space. We've got homes, stay at home.
And have fun there, because we do understand that it's festive season. We want to go about, we want to have fun, and we want to enjoy. We want to go sightseeing with our families, and also see long lost cousins from all the way from Cape Town, Eastern Cape, your Joburg. But then it's also very important now that we look at these areas that these people are coming from, or now we stay at home and refrain from finding ourselves in those cities, because now that is also a way of contracting the coronavirus. It's very important that we do not move around. We do not travel unnecessary. So I want you to speak to me in the comment section. Pose your questions through. Now let's chat, let's engage together, because we're just here to analyze the address of the President of the Republic of South Africa. So let's find out, how are you feeling about the restrictions put at hand? Any surprises? Or you just want to put through, a comment and let us find out. And, the President also mentioned about the vaccines that are to be introduced, and further comments he will make as we enter the new year of 2021. So how do you feel about the introduction of vaccines?
Vaccines are a thing that maybe the health sector, through the World Health Organization, has been trying to find for this maybe invincible enemy called COVID-19. South Africa is not out of it, and we are also in it. So we hear from the President what he says, and there's lots of criticism about the vaccines and everything.
Definitely.
However, we need to, because we've got many vaccines on Earth. We've got vaccines for malaria, we've got many vaccines, flu vaccines. So maybe this will be one of the vaccines that we'll use maybe to protect our immune system, because now it's clear it's a battle of the immune system. If your immune is low,
then you are most likely to contract the virus and die. It's a very sensitive issue. It's a very sensitive issue, and people aren't really sure how to go about it. Some people are saying, let's go ahead and get the vaccines, and some people are saying no, but what are you saying? We are all about what you are saying. Tell us how you feel about the vaccines that are maybe to be introduced in this coming year. Do you feel like we need the vaccines or not? But then put your comment through there. We want to know what you're thinking, how you're thinking. Remember, we're all here, we're just talking, we're engaging, we're analyzing, and just keeping the conversation going. So what was the one important thing that you picked up and you would love to tell our viewers at home?
Is that when the President was speaking, this talking about restricting the country, it's a very sensitive matter, in a manner that it affects people's hearts, work, and also maybe way of living. And people are going, if they are not working, they are going to be more relying on government. That's why I picked up that they just care about us. Some were saying just close those provinces. or do anything. However, government have never been that harsh this time around.
Well, there you have it. That was our analysis for tonight by the speech that was made by the President of the Republic of South Africa. Thank you so much for joining me today and also being part of this conversation. And thank you, viewers at home, for being with us. Remember, I am your host, Princess, and this has been the President's Analysis. Good night.
Good night.